Good afternoon, everyone. Welcome to the webinar on implementing the Choosing Wisely program, Practices Sharing Lessons Learned. Before we start, here are a couple housekeeping items. You can download the slides and resource materials, as well as type in the chat box on the right side of your webinar screen. And please note that you will be muted until the Q&A session. We will also send you a recording of the webinar and we'll post the slides for download at the PCPCC website. We encourage everyone to participate in the conversation by sharing your comments in the chat box. And please feel free to submit your questions anytime in the chat box or the question pane on the right side of your webinar screen. We will answer your questions at the end of the presentation. And last but not least, please take the post-webinar survey. Your feedback will be greatly appreciated. All right, great. About PCPCC. PCPCC, or Patient-Centered Primary Care Collaborative, aims to advance an effective and efficient healthcare system built on a strong foundation of primary care and the patient-centered medical home. Our mission is to promote collaborative approaches to improve primary care. We also promote the shared principles of primary care, which represent all aspects of healthcare. We focus on the concept of patient-centered care through patient-family engagement and patient activation, which will help reach the goals of improved cost, quality, and experience outcome. Through the Transforming Clinical Practice Initiative, PCPCC Support and Alignment Network strives to improve patient and family, clinician, and community strategy for engagement. We are working with our key partners to provide valuable education program and technical assistance tools to help practices meet their needs. To learn more about how we can help your practice, please visit pcpcc.org/TCPI. And now, I would like to turn to my colleague, Kelly Rand, from the ABIM Foundation to introduce the speakers. Kelly?
Thank you so much, Tanya. And welcome, everybody. We're excited to have a great lineup today of speakers. We're going to start off with Dr. Lisa Letourneau. Dr. Letourneau is the physician consultant for the Choosing Wisely Learning Network. She previously served as executive director of Maine Quality Counts, a regional health improvement collaborative, where she led several quality improvement efforts. Dr. Letourneau is a graduate of Brown University and the Dartmouth Brown Program in Medicine, and is a board-certified internist who practiced emergency medicine for 7 years before beginning her work in clinical quality improvement. She holds a master's degree from the Harvard School of Public Health. Welcome, Dr. Letourneau.
Lisa, can you hear us?
Can people in the audience hear?
We can't hear her. It also doesn't appear that she's on the panelist. Is there a way to promote her to panelist?
Oh, okay. One moment, please.
Just a moment while we get over this technical difficulty.
Now.
Lisa?
Hi, can you hear me now?
Yes.
Oh,
Yes.
super.
Perfect.
Thanks. I think I was muted, sorry. So thank you all for joining, and sorry about that. I think you're going to go ahead and advance, Tanya?
It will actually be Kelly to
Kelly?
change the slide.
Great, so next, thank you.
Yes, and I'm happy to do that. Tanya, you have something blocked.
There you go.
Thank you.
Yeah.
Just tell me when you'd like me to advance the slides and I'll do so.
You can go right ahead. Thank you so much. So thanks everybody for joining today. I've had the really good fortune to be involved with the American Board of Internal Medicine Foundation's Choosing Wisely initiative for many years now. Actually, you're going to hear from one of my colleagues at Maine Quality Counts a little later in this session, Kelly Slate-McCabbage, who's been very much on the ground working with practices and communities. I've also had the good fortune to be on the PTN side of things. I really feel very confident that the content of this webinar and the content of the Choosing Wisely program can very much be something that can help PTNs, SANs, and provider organizations to help practices and patients have better conversations about the wise use of resources in healthcare, and to make better choices really about testing, procedures, and treatments for patients. So we think that there's several things that we can help you with today. You can see the objectives for today's session listed here. Tanya, I'm just hearing a little bit of feedback. I don't know if it's possible to mute other lines, or hope that's not me, but well, go ahead. So I suspect that many of you are familiar with the Choosing Wisely program. Kelly, I don't know if there's a lag, but there you go. But it is an initiative of the ABIM Foundation, going back now several years, back to 2012. Really was an initiative initially reaching out to clinician groups to say, okay, you all know that we're doing things every day that probably could we could make a better use of our resources. So what are some things that we should question, not do, not prohibit doing, but really have conversations and ask questions about what is the value of this test or procedure, go ahead, in order to help clinicians and patients make better choices. So ABIMF literally went to each of the specialty organizations. You can go ahead, Kelly, thank you. And ask them what are the top 5 things that you think maybe we should question or not do. And from that created a whole list of things to question. They started that really because they knew that we as physicians and clinicians needed to be better stewards of very expensive healthcare resources. And again, as PTN and SAN participants, I think you all know this already, right? That many estimates are that we spend up to 30%, up to $3 billion, numbers growing every day, on unnecessary and potentially wasteful test treatments and procedures. But those tests and procedures carry with them their own potential for harm, right? That unnecessary tests can lead to additional tests, to biopsies, and to the expense of a patient, the cost coming out of a patient's pocket, particularly now with high deductible plans and high first dollar payments. And that really, if we're going to change the culture of more is better in this country, we have got to get patients and clinicians questioning these things and talking about it and really challenging that sentiment often of more is better, and understanding that the use of more tests and procedures is not always helpful and can, in fact, be harmful. Go ahead, Kelly. From that, we also know that we have a real obligation, a moral and a financial obligation to address this growth in healthcare spending in this country. This is now, the slide from the Commonwealth is actually a couple years old, but the trend has only continued, the United States being an outlier. And again, I think you all in this arena are familiar with this, but we are heads and shoulders above the rest, and not in a good way, right? Go ahead. And again, from different analyses, this one is from Don Berwick, estimating that up to a third of those costs are related to overtreatment and potentially are avoidable. Go ahead. So we see the Choosing Wisely effort as a way to really try to address some of those issues. As I mentioned, ABIMF very wisely went out to their colleagues in the different specialty societies, asked them to identify the top 5 things that they thought could be questioned, potentially low value tests or procedures, and partnered initially with Consumer Reports to try to engage the public to get this information out there. Through those efforts, they've now developed, I'm sure it's more than, it says 450, but more than 500 different recommendations for clinicians, and with support from the Robert Wood Johnson Foundation, we're able to support several rounds initially of funding to help clinicians raise awareness in their communities with both patients and other clinicians. Go ahead. Again, I mentioned we were fortunate at Maine Quality Counts to be the recipient of that funding, so have had efforts on the ground here that you'll hear more about from Kelly Slate-McCaviage. But through that, those efforts, ABIMF has now engaged more than 70 medical societies across the country. Go ahead in identifying those areas to question. Through that partnership with Consumer Reports, also developed sort of an overarching approach to asking patients, in addition to questioning, do I need antibiotics for upper respiratory infection or this imaging for low back pain, also stepped back and took this more general approach of questions that we should all ask our doctor with any test or procedure. So the 5 questions, and you'll hear more about that from one of our partners here in Kansas, but those key questions: do I really need this test or procedure? What are the risks and potential side effects? Are there simpler, safer options? Number 4, I love, what happens if I do nothing, right? What happens if I do nothing? Can I just wait this out for a bit? And then number 5, what does this cost, which we know is a real challenge for many clinicians who actually don't have great information on what it costs. But again, we would argue that as clinicians and stewards of resources, that we need to be more familiar with that and at least have ways to help our patients understand these costs before we incur expenses they may not be able to afford. Go ahead. Over the years, ABIMF has really done a fantastic job of partnering with the various specialty societies, getting out these specific recommendations around specific test procedures and treatments, have made lots and lots of partnerships out in the community, and developed many patient materials, provider materials, and now, go ahead, it truly is a global movement, and we have Choosing Wisely being adopted in over 19 countries across the globe. So phenomenal expansion and awareness, I think, of this effort over the past now 7 years. Go ahead. And really, again, a lot of work to help change perceptions and change the culture. Most importantly, I think, is the question of how do we get to results. So, we can share a lot of recommendations, we can share information, but how do we really get to results? And I think that's where all of us who are involved in the Transforming Clinical Practice Initiative, whether a PTN, a SAN, or participating provider organization, this is really where the rubber meets the road. And again, we're very excited today to have some folks on the ground talk about how they've used Choosing Wisely. But we know from working with partners across the country now that the best way to get to results, and we know this from other quality improvement science, right? This is not new, but the best results are obtained when you undertake multiple interventions at the same time. So some combination of recognizing, establishing, adopting clinical guidelines, identifying clinician or physician champions, bringing education to clinicians and patients, providing data feedback, changing the workflows, right? Getting things into EMR order sets that might bring up a flag or a prompt or say, did you know, this test is not indicated. And through those things, we know from the work that ABIMF has done with grantees around these couple rounds of projects that they get the best results, including seeing reductions in some of these targeted areas: antibiotic use for upper respiratory infection, routine pre-op testing, things like EKGs and labs, unnecessary preventive screens such as Pap tests for women over a certain age or at a frequency that exceeds guideline recommendations, et cetera, that we've seen real reductions in those types of things. Go ahead. We also know that the more we do, the better the impact, right? So doing several of these things at once, as I mentioned. So people will say, well, what should we do to actually translate choosing wisely to reductions in unnecessary care? And I think what we've learned is it's not one thing, it's many things at once, several things. Go ahead. Additionally, I think, again, it's a great fit that this program is really a terrific fit for transforming clinical practice for all of us as SANs and PTNs. The slide's a little bit hard to read, but you've got a link to the full slide set. You can blow it up. It's also, you see the link here on the Quality Counts website. And again, kudos to Kelly Slate Cabbage, linking the TCPI practice improvement metrics with some specific activities and initiatives that could be undertaken through choosing wisely as a way to meet some of those metrics, and particularly the patient and family engagement metrics. Go ahead. We have seen some very innovative approaches through some of, again, the grantee programs, very interesting efforts at UCLA and LA County and the Washington Health Alliance. I'm going to drill down on a few of those. Go ahead. First, in UCLA, again, they've employed this notion of many things at once. So employing multiple clinical interventions, a combination of guideline change, physician champions, education. The commitment posters are very interesting. So they created these posters that they would post in exam rooms that said, we as the clinicians of LA County healthcare system commit to not giving unnecessary antibiotics out of the best interest of the health of our patients. And then you have the clinician sign it and have it right there in the exam room so patients could see it. So again, really interesting combinations of innovations, and through that saw some impressive outcomes. You can see a 45% reduction in inappropriate antibiotic prescribing, significant reductions in unnecessary pre-op testing. They specifically looked at cataract surgery. So you can see here some pretty impressive results. Go ahead. Additionally, we've got places like the Washington Health Alliance that has a statewide Choosing Wisely collaborative that used an analytics tool from Milliman to look at the rates of likely unnecessary or wasteful spending to create this report called First Do No Harm. Go ahead. And drill down on some specific areas of potentially wasteful spending, and found very interestingly that they had a huge proportion. So 44%, 45.7 total of services were determined to be low value, looking at over 1.5 million services provided. Go ahead. They also broke that down by county, so they developed a heat map so that the providers in Washington State could see, were they in an area where maybe some of these practices were more common, and providing real opportunities for drill down. Go ahead. I think there are lots more opportunities moving forward, particularly recognizing that clinicians need to be leaders in this, really publicly embracing efforts to reduce overuse, swimming upstream against that tide of the myth, the cultural belief in our country of more is better, and being able to talk to patients about the real potential harms of overuse, trying to build Choosing Wisely prompts and decision aids into the workflow, into EMRs, promoting the use of the 5 questions broadly, and really bringing patients and families, again, another certainly PTN and SAN objective, into the planning process for some of these interventions. Go ahead. I think there certainly are lots more opportunities, again, to integrate these efforts across different parts of the healthcare system. So working directly with clinicians, but also payers, delivery system leaders, consumers, our government partners, to really bring this to scale. Go ahead. And with that, we wanted to close on this section. I think we said, Kelly, maybe we'd take 1 or 2 questions if there are any now, but also leave plenty of time for question and discussion after our 2 presenters who are going to be talking about implementing Choosing Wisely on the ground. So if anybody has a question or 2 right now, seeing a chat. I don't see a question. So any questions, feel free to, can people unmute themselves? Tanya?
This is Marilyn. Looks like I have a question from Laura, who's saying where they might be able to find, if these metrics are available, then where can they be found?
So Kelly Rand, feel free to jump in. My understanding is, ABIMF doesn't necessarily develop metrics based on choosing wisely recommendations, but a lot of other organizations have. And one of my first places to point you is that Washington State report that I referenced just a minute ago. They actually either pulled from existing, there are several HEDIS measures that align with choosing wisely recommendations, and then they identified others as well for that report that they ran. So Kelly Rand, do you have other thoughts on that?
Yeah, no, I think you answered it just right. There are no set benchmarks yet, since this is a relatively new field. But Washington Health Alliance has created a number of specifications that you can use for both claims and EMRs, and you can either find it on their Washington Health Alliance Choosing Wisely page, or if you go onto the Choosing Wisely website, you can also find a link to ask for those specifications from Susie Date. And then, as Lisa said, there are a number of HEDIS measures that also align with the Choosing Wisely recommendations, but there is not a specific set of metrics.
Great. Anything else right now, Marilyn, that you're seeing, or if anyone wants to unmute?
No.
Okay, well, maybe we should move on to our next speaker.
Perfect. And I seem to have lost control for the slides. There we go. Nope, still don't. Okay. Terrific. So I'd like to welcome Melissa Stroh. She's a certified physician assistant and clinic manager at the Rural Health Clinic at Kiowa District Healthcare. Kiowa is an 8-bed critical access hospital and rural health clinic in a community of about 1,000 people. She received her PA training from Wichita State University and her graduate degree in kinesiology from Kansas State University. Welcome, Melissa.
Hi, thank you. Like she said, I'm a PA here in Kiowa, Kansas. Until recently, I was actually the clinic manager here as well, so I got to be very involved in learning about all the methods to improve our quality service, which include shared decision making. So I'm just going to explain how we implemented this Choosing Wisely program at our facility. I was initially introduced to the Choosing Wisely campaign through my representative, Jill Doherty. She's with the Kansas Healthcare Collaborative. It's part of the Compass Practice Transformation Network. We were looking at ways to improve our shared decision making, and this model was just a no-brainer. We knew we had to use it. It was just such a simple and straightforward program that we could easily implement here. So in the beginning, we just hung the posters in the exam rooms, but we didn't really know if our patients were engaging with the information, especially if us providers didn't draw the patient's attention to it. So I was trying to find a way that we could guarantee that every patient was provided with the Choosing Wisely information at every appointment. So currently, well, before we implemented this, I should say, we were already giving our patients a checkout slip at every appointment. So on this slip, like you can see in the slide, we have important appointment information like their vitals, follow-up instructions, and other miscellaneous reminders for the patient. So I thought we could easily just print that Choosing Wisely information on the back of our checkout slips. This would be a guaranteed way to get this information to every patient every time. So I'll kind of just walk you through a normal clinic patient visit. So the nurse pulls the patient back and gets the patient's vitals and chief complaint. Then the nurse writes down their vitals on the checkout slip. But before the nurse goes to get the provider, the nurse will direct the patient's attention to the back of the card, and they'll say something along the lines of, here are 5 questions that you can bring up with your provider during your appointment to ensure that you're getting the care you desire. So then I, like the provider, will come in and assess and treat the patient. So as per any normal visit, we will come up with a plan, whether that be maybe further testing or possibly medications. After I feel like I've explained a proposed treatment plan, I'll say something like, now that you've had a chance to review the Choosing Wisely questions, what other questions do you have for me? So I never ask, do you have more questions? I always feel like I get a much better response from the patient when I ask that open-ended question. So from a provider standpoint, I know I always think I have answered all of the patient questions at their appointment. However, I know sometimes the patient could be overwhelmed and just can't think of any questions at that moment. Then when the patient goes home, they think of 10 more questions or calling the nurse back in 10 more minutes and asking all these questions. So this program just really prompts the patients to ask all of those questions at the office visit while they're sitting there with their provider. I feel like we are able to have a much more productive and educated conversation because of these prompted questions. We can talk about why the patient doesn't need this antibiotic today, or they really don't need that chest x-ray today. And I feel like my patients are more confident leaving their appointments because of our shared decision making that we did at their appointment. And then at the end of the appointment, the patient leaves with their checkout slip. It's something that they can hang on the refrigerator and refer back to. So, I mean, for everyone else trying to implement this, my advice is just to keep it simple. It doesn't have to be some huge project, you know, involving the huge state, like she was mentioning earlier. Just start small. It's a simple tool that can just really help strike up a conversation with your patients. And we were able to implement it cheaply just by printing it on the back of the checkout cards, but, you know, still getting the patients that important reference material about their health and care. So that's all I have. Does anyone have any questions about how we did anything like that?
I do just want to say what I do love about your project, Melissa, is that it is very achievable for most practices. We hear a lot of worries, I think, from people who talk to Choosing Wisely, that they need to understand what their data is and have a huge QI project. But I think you really are starting with patient activation with the project that you're doing, and it's something that almost every practice can start easily. So I love the simplicity, but also the effectiveness. Have you heard any feedback from your patients about the questions once you started using them?
Yeah, I actually have, mostly from, I'd say, the elderly population, because, you know, a lot of times they usually come into their appointment with their little notepad with all their questions already written down. And so, you know, they've thought of these questions for days or weeks, and a lot of times at the appointment, they just wouldn't have that trigger to prompt those questions. So they've really said, oh, you have the list ready for me. And so they really like having that list to refer to and ask all the appropriate questions at the time.
Yeah, I think that's a great point too. A lot of feedback that we've heard from when we've talked to patients is that that getting that permission to ask questions is really important. That they want to ask questions, but that time is often so short and they're just not sure if they're allowed to. So the very explicit permission is an important aspect of it. Any questions for Melissa?
Yeah, this is Marilyn. I do have a question from Deborah, and she wants to know, did this make your visits longer?
I would say sometimes, honestly, yes, a little bit, but as far as like follow-up cares, like I mentioned, or calls, excuse me, like I mentioned earlier, have, I think, really reduced. We're not getting near as many phone calls to the nurses afterwards, and the nurses have to say, okay, we'll ask the provider and give you a call back. It's really reduced a lot of that back work that we've had to do previously because we're just addressing all of those issues right then and there at the appointment.
And this is Lisa Letourneau asking, did you get any pushback from other clinicians in your practice about offering the 5 questions?
Honestly, yes. At first they were hesitant because they, like the previous question, they didn't want to drag on the appointments longer than they had to. But when I just explained to them, you know, like you don't have to read it question for question to the patient, they already have it there in front of them. They really have adapted well and really taken hold of it, and it's worked really well.
Great. Any other questions? Terrific. Well, we'll still have a time for questions and answers at the end of the webinar if you think of anything else for Melissa. And thank you, Melissa. Now I'd like to introduce our final speaker, which is Kelly Slate-Fitzcabbage. Kelly Slate-Fitzcabbage serves as Project Manager of Consumer and Community Engagement at Maine Quality Counts, a regional health improvement collaborative for Choosing Wisely and for the Northern New England Practice Transformation Network. Kelly holds a master's degree in health education from Purdue University, with several years of experience in the nonprofit sector as an executive director of the American Lung Association of Indiana, executive director of the Maine Osteopathic Association, director of public health policy at Maine Medical Association, as well as the director of continuing medical education at the University of New England College of Osteopathic Medicine. Welcome, Kelly.
Well, thank you. I should have had you not read all of that, but that's okay. So it kind of looks like I jump around a bit, but I just wanted to say that I've been very fortunate to be involved with ABIM Foundation as a grantee over the years, and also with working with Lisa Letourneau. It's been quite the experience with Choosing Wisely, and you can go to the next slide. And I welcome everyone on our webinar today. This just kind of gives you an idea of where we started back in 2013. I'm going to go through some of the details of what we did with our practices. We really tried to get some of our practitioners on with us today, but unfortunately very busy, so I'll try and do my best to relate the information and the lessons learned that we went through with our different projects. We really started out at a statewide level with a statewide leadership group. We thought that it was best to really get the word out about Choosing Wisely throughout the state with our larger health systems, and brought together this leadership group that met often throughout the year to give us guidance and leadership. And then when we received the grant, we worked with 4 primary care practices as our first focus on implementing Choosing Wisely in the primary care setting, and then went on because we wanted to integrate Choosing Wisely. That was kind of our mode of operation, is how else can we integrate Choosing Wisely in what we're already doing from the work that we are involved with. And so we went to the State Innovation Project, and we ended up working with 10 more practices, some of which focused on Choosing Wisely as a whole, implementing the 5 questions, and some dealt with shared decision making, dealing with low back pain and Choosing Wisely. And then we kept hearing from our providers, they're like, we really need to have you get out in front of the clinical visit and start talking with consumers out in communities to talk about Choosing Wisely and raise their expectations to be more engaged with their care, to feel more comfortable asking the questions. So we spent quite a few years, 3 years, working with 2 large communities, but we also simultaneously worked with 3 health systems as well with lead physician champions, and I'll get into that as we go through the slides. And then we thought, well, Choosing Wisely, question number 5, how do we really integrate cost of care conversations in the clinical workflow? What does that look like? So we'll talk a little bit about that. And then Lisa did tee up some of the work we're doing with our Practice Transformation Network, not only with the patient and family engagement metrics, which you can use Choosing Wisely for all 6 of those, but also looking at how we can decrease unnecessary care, specifically with advanced imaging for low back pain, utilizing some of the Choosing Wisely materials. So next slide, please. So our overall strategies really were to partner with system leadership, looking at who are those physician champions. Really had created a lot of success for us to work with physician champions on an ongoing basis, specifically through the 3 years that we were working with the community as well as the systems we were involved with. And also taking a look at how can we integrate this work into their current QI efforts or their projects, and also looking at what's happening in your community that's affecting quality of health. And one of the first emerging initiatives was, how can we reduce antibiotic use? We all know that it's overprescribed. Looking at that, as well as looking at chronic pain issues, whether that be with low back pain or other chronic pain issues, working with Choosing Wisely. And then, of course, working with opioid epidemic and integrating that with chronic pain for prevention, and also looking at other ways to reduce benzodiazepines and, looking at that world. So we kind of tried to look at our environment and do that scan and talk with our physician champions. And so you'll see that I have two columns here. We really spread our efforts out so that we could encourage culture change and working with our medical associations, having them get on board as one of our leaders on a more general basis and working with their members, working and presenting at their conferences in whether it be the PA Association, the Osteopathic Association, and then looking at where can we go and present at Grand Rounds. I know Lisa was very active in that arena to really, you know, start putting out the feelers and talking about choosing wisely and changing the culture, so to speak. And then offering maintenance of certification for those physicians who are very interested in getting a 2-for-1 opportunity while they're working with choosing wisely. And then on the clinical side, on the ground in the clinical setting, like Melissa's talking about earlier, and how we can work with our provider teams. How do you integrate choosing wisely? How do you utilize the whole team? What other kinds of things are happening in the system? Can we get things on the video monitors? Oh, let's engage our patient and family advisors. Oh, patient portals, what can we do there as well? So we're kind of looking at the whole environment. Next slide, please. So out of that came the toolkit you'll see here, using choosing wisely tools to empower patients. This toolkit was really for the entire healthcare practice team. So we kind of developed that. It's very simple. And I like how Melissa looked at it, and we also looked at it. It's like, let's look at a simple approach to try and integrate choosing wisely into the clinical workflow and having those conversations utilizing the entire practice team. So you'll also see that the AMA steps forward, we implemented and integrated their modules, which are excellent if you have not seen those. And then further down the line, when we started working with cost of care conversations, we created an online module. And you can definitely go there. We have the links, and it has all of our resources and additional information in those modules. You can skip through those. You don't have to ask for CME or anything of that nature. So I encourage you to look at those, because I'll go through some slides here today where you can access the information in that module. Next slide. Okay, this you probably are having a very hard time viewing it, but basically in that toolkit that I mentioned is that when we worked with our 4 initial pilot practices, the entire practice team was, you know, how do we even start? How do we even start to have a conversation? What kind of ideas could you give us for scripting for each one of our healthcare team members? So on this screen, you'll kind of see a visual of how a patient comes into the office, where they are, what you can have in the waiting room, what happens with the MA, what happens with the provider, and then in the colored boxes, you will see that the PSR has scripting, you know, outlined here, and, you know, scripting for the MA during the rooming, and some alternative scripting for the MA and scripting for the provider. So it just kind of gave them a high-level approach. And we actually role-played these and worked with them in groups to gain more familiarity with the content of the information, with the choosing wisely materials, and actually had a very hands-on approach to this. Next slide, please. This is just a different visual to help various practices that we've utilized, that maybe that graphic in the previous slide didn't work, and maybe this made more sense with them in looking at a patient visit flow chart in when the patient checks in, when they're in the waiting room, when they're in the exam room. So you can kind of utilize that as an idea. Obviously, every practice had a different way of how to approach this, so these are just a couple of examples for you to take a look at, and if you have any questions, we can certainly answer those at the end. Next slide, please. So that was with, those previous slides were with getting that conversation started and the workflow going for choosing wisely in at the clinical practice during the visit. This then, we jumped off of that because question number 5, how much does it cost? We really felt, and we worked with a lot of patients, we did a couple of focus groups, we were out in the community, and they're like, how do you even address how much does it cost? So we jumped in with another grant opportunity to really dive down into how this could really occur and pilot this in 2 systems that were willing to work with us. It wasn't easy. It was very difficult. This was one workflow that one of our practices put together that worked for them. So it may not be what you would consider as your workflow that you would want to utilize for yourselves, but at least it gives you an idea of the difficulty of really putting together a conversation that needs to occur into a clinical workflow. And so you can see the different aspects occurring during that workflow, and then you can take a look at, this was a research study, so when you get to the right-hand column, we had a lot of other issues going on with research and recording and taking a survey and gaining information from the patient themselves as to how that cost of conversation occurred for them. Okay, the next slide really then goes into the scripting aspect of it. How do you even have these conversations? What does the PSR, when a patient first arrives at the office, what do they talk about? What can they do upon check-in? For example, and I know it's so small here, but I'll give you one example. Upon check-in, the PSR may say, our practice is involved in a pilot project to determine if cost of care conversations are helpful to you as part of your treatment today. And they could give them the 5-question choosing wisely, either the RAT card or the wallet card, whatever's provided for them. And then have it in the exam or in the waiting room, you can have your choosing wisely materials, the 5 questions. And then we had some of our practices who put up a nudging poster up on the wall, very large, that talked about, do you have questions about your healthcare treatment and costs? And so it kind of would outline some bullet points there as well. And so you can see that every member of the team does have some involvement in having that conversation, whether that be the provider or the MA, nurse educator. So these can change up as to what your needs are and how your workflow occurs. And they found it to be very difficult to start. We solely looked at reducing advanced imaging for low back pain. And so it was a very concentrated, small amount of patients that they were beginning this process with. And the feedback we received from them was, let's not even look at one diagnoses. Let's just do this with everything, because it's that much easier just to continue the conversation throughout the day and not have it just be for patients arriving with low back pain and so forth. So just to give you an idea of how that worked. All right, next slide. This is a visual, keeping it simple, helping to change the culture and gaining patient activation. If they see these things in the exam room or in the waiting room, I can tell you that the far right up top, that was a 3-foot by 5-foot poster that this practice decided they wanted in their waiting area to make it large, make the presence fairly big. You could even see it from the parking lot. So you have your RAT cards on the walls, you have your table, you can have an exam room where you can see it. And this MA really suggested having the patient information sheets right in the exam room when they were confronted with a certain diagnosis, whether it be antibiotic use or benzodiazepine use or advanced imaging for low back pain, because those were the focus areas we were focused on. So the staff were very involved in providing feedback, as well as the providers. All right, next slide, please. And then we started working with our physician champions with blinded data. And as I said, we had 3 focus areas that I mentioned. And this happens to be bronchitis and the use of antibiotics. And so these 3 systems, our physician champions would come together every couple of months to talk about, and we did gather the data and worked with their IT to take a look at their rates against each other in blinded format. However, they became so interested in looking at their own rates, they wanted to unblind the data and begin to focus on, well, what strategies are you using, or, you know, what outliers, and how do you work with your providers who might be outlying upon, you know, the measure and the appropriate use of antibiotics. So it really started a much higher level conversation. And as you can see, the one that was lowering their rates had an idea to hand out patient wellness bags instead of an antibiotic. And so they really started to get on board to provide something for the patients. We care about you. However, it's not really necessary to have an antibiotic, but please take this home. And, you know, if this isn't working for you in a couple of days, obviously, you know, they'll receive a call back, but it's still continuing on with the wellness bags. And it's really been a great opportunity to work a little bit differently with patients. So that's kind of the story behind that slide. So next slide, please. And I'm getting there. Overall lessons learned from our perspective, working with the practices, that it's best to try and integrate into their existing quality improvement initiatives, not another thing to add on. What's already happening? If it's a TPCI practice, what's happening with their patient and family engagement work, their MIPS, can we align it with that? We aligned it with the state innovation model as well, incorporate strategies to keep up the momentum, working with them as to leveraging what's going on in their community and their QI priorities, so that, I've kind of repeated that over and over again, but it's really necessary not to have one more thing happening. And then really, if they can drill down on the data, at least starting simple. Antibiotics was very easy to start with many of our systems, and then they became much more interested in how they could look at it, who was doing what with prescribing, and begin to have more of a concentrated QI effort once they started seeing the data. And then working with our pilots, we really met them where they were. We did provide small stipends for their time, and then looking at the team-based approach, and then having some type of a technical assistant aspect to working with them, such as with the toolkit. Okay, the next slide, please. These were the lessons learned from the practices. They actually wrote this out and reported back to us. They felt that they needed the continued long-term emphasis and integration. So, how do they integrate it into their QI efforts? They felt that the signage was extremely helpful because they didn't have to do much. It was already there, and they could, bring it forward much easier and talk about it and have the patient educational materials available to a certain extent. And as I've been saying, not one more thing, be aware of that change fatigue and look for integration. And then they were looking at how important that data was once they were able to get that out of their EMRs. So that to them was, a very exciting opportunity to take a look and see how they were performing and how they could do better. Next slide, please. This is additional lessons learned from the practices. They felt that they wanted to educate the patients early in the implementation phase, whether that education was visuals or part of the conversation in the visit very quickly. They really thought that this was ideal for their patient advisory committees to provide input, which many of our pilots did do that, and it really energized the practice that they had their patient advisors involved in, trying to help engage other patients in this work. And then obviously educate the entire practice teams. They would have staff meetings. They would have Lisa Letourneau come in and do grand rounds for their providers. They indicated that with the admin clinical meetings, especially with antimicrobial usage and stewardship, that was very important. And then quality team meetings and lunch and learn. So those were all very important to them to integrate, choosing wisely because of their busy, hectic clinical lives during the day. So that's just some of what we learned, what they learned. It was incredibly helpful for us to see what it's like to be on the ground with them in a very fast-paced environment, as Melissa can certainly know how that goes on a daily basis. So that's all I have there. I do have my contact information. I know Kelly Rand has it, Lisa Letourneau. We've all worked together, and we'll help anyone in any way that we can to explain some of the information I quickly went through today. So thank you.
Great, thanks so much, Kelly. And I think you brought a great point of aligning. And the alignment, I think, is not only from initiatives, but also actions that people are already doing. So even Melissa's intervention falls into the aligning, because you're already giving out a slip to the patient. It wasn't a new thing. It was just adding it to it and enhancing it. Or, as Kelly mentioned, putting it as a standing meeting for meetings that are already happening, because it's so hard to have additional meetings on topics. And I also think Kelly brought a great point up about the lessons learned of the long-term needed, because often reducing or stopping something that you've been doing is harder than adding something new. I think that's true for everything, especially noticeable at the beginning of the year when people are making resolutions to, eat healthier and, reduce bad habits. It's hard to stop doing things. It's easier to add things. So that's just something to keep in mind when thinking about implementation. Do we have any questions for Kelly and the work that's being done in Maine?
Yes, we have a couple questions. This is from Ann Zedek-Sumner, and she thanks you for the presentation, and she was wondering about data availability, especially related to low back pain and imaging. She says she works with several practices whose EHR has eliminated reporting on the low back pain measure. So she was wondering, have you run into this, and if so, and if so, how do you deal with this challenge? Also, if you could describe the data collection related to reduced antibiotic use, that would be helpful.
Okay, we did not have the challenge of collecting the data. Is that Lisa? Lisa, I wasn't sure if I heard someone coming in, but we were able to, and our practices are very interested, and it also goes with our work with our practice transformation network of reducing unnecessary care. So our IT systems were able to pull the data. We did have to pull together a technical specifications manual, of which I'd be happy to share, so that if there is a chance in the future that you'd be able to pull that data out of your EMRs, it is a fairly straightforward presentation to assist pulling the information in the right way according to, you know, what's needed. I mean, behind the scenes with IT, they had to tweak this a lot and kind of figure out how best to pull the information, especially for not doing advanced imaging for low back pain. That's kind of a measure to pull out. Antibiotic-wise, with the data, I wasn't sure exactly what your question is, but that was easier. There was an issue in regards to should you pull all of the issues together that deal with antibiotics, and I know that, don't quote me on this, but I think Washington pulled together a combination measure for using antibiotics, and so you couldn't say, well, maybe it's not bronchitis, maybe it's something else, and I'll skip over that in my EMR because it's not for that particular diagnosis, to go on that slippery slope of, you know, I didn't really prescribe an antibiotic for bronchitis, but I'm going to put it for this. So they dealt with that, combining all the measures together to reduce the use of antibiotics. And our system started looking at that because once they looked at their data, they were noticing a spike in other diagnoses occurring. So they would have more conversations with their providers on what was occurring in regards to that. I'm not sure if I answered the question directly, but I can certainly work with you offline if that's needed. Happy to do that.
And Kelly is correct. Washington State did create a specification specifically for antibiotics and upper respiratory infections so that you could eliminate that sort of diagnostic drift that Kelly was.
Yeah, diagnostic drift. Thank you, Kelly.
So another question that we've received, first of all, they wanted to know if they can have the contact information for Melissa Stroh. This is Dr. Karen Bowman is asking that. So we can make that available. And there was a question, another question for Melissa. They wanted to know, do you use different languages for the materials you provide patients?
So currently on the printed ones, we do not have other languages. We're a pretty small rural community, farming community, so I don't think honestly we have any individuals in our area that don't speak English. So on the rare occasion that we do have a Spanish-speaking person come in, we have a, I don't remember the service, we call into a telephone, and we have a telephone interpreter, but I do not have any printed Spanish materials currently.
So Spanish materials are available on the Choosing Wisely website for those who want to use it. And the link to the 5 questions that both Melissa and Kelly highlighted is on your handouts on the right-hand side.
Okay. And Lisa, I think, had some comments. She is unmuted, so if you had a comment, Lisa?
Yeah, just about the measurement piece, because I know that's always a challenge. Whether that's, what is the existing measure? And again, I think the Washington State Manual can be helpful in that, but then also what's the right number? And Kelly Rand mentioned up front that there aren't set benchmarks by ABIMF, because I think, again, the focus is really more on having the conversations than saying a certain rate is right or wrong. But what we do know, and I think everyone would agree, is that for many, many of these things, the rates are higher than they probably should be. And so the approach I've seen some practices take, or discussions I've seen, is for many of these choosing wisely measures, if you look at it within your practice and it's happening more than 40% of the time, there's probably room for improvement. So while we don't know if the right rate, it's not zero, right? It's not zero, but we don't know if the right rate is 5% or 10% of the time. It's probably not 40, and it's certainly not 60 or 70. So just another way of thinking about that and approaching it.
No one else has written in any questions, but I think the audience is unmuted. So if you have a question, please ask. Hello?
Yeah, me too. Yeah. Well, because he doesn't have a headboard that has anything to like him.
Sounds like we may not have any other questions. I don't see any others.
Okay. If we don't have any more questions, and of course, if you have any questions after the webinar, please feel free to reach out to us from the contact information on the slide. We will be happy to answer them.
We'll make sure that Melissa's contact information is available as well.
Okay. All right. So thank you everyone for participating in this webinar, and please take the post-webinar survey, and your feedback will be greatly appreciated. And we will send you the recording, and the slides will be posted on the PCPCC website within 24 hours. And again, please feel free to reach out to us at our contact information on the slide. Thank you very much, and I hope everyone have a good day.
Thank you.
Thank you.
Thank you.
You guys want to stay on? Are you, Tanya and Marilyn? Are you still on? Kelly?
Yeah.
Great.
Yeah, we can.
Okay, super.
Okay.
Kelly Rand, are you on? Oh, there we go. I'll just tell Kelly that we're on. Just see if she wants to.
You don't need me to be on, do you? This is Kelly.
Oh, no, but thanks so much, Kelly.
Sure thing. Thank you all. Great.
Yeah, thank you, Kelly.
All right. Have a great one. Take care.
Thanks. Hey, so I just wanted to apologize for that. I don't know. I think I had